It's now time for our discussion on the religious voice. But before we do that, let's listen to what President Uhuru Kenyatta has been saying, calling upon religious leaders not to abdicate their responsibility in keeping the political leaders honest. The head of state says it is imperative that the clergy demonstrates faithfulness to their congregation by using their office to keep leaders accountable. He was speaking at the 50th anniversary celebrations of the Anglican Church of Kenya at the All Saints Cathedral.
You are out there to save souls, but you're also out there to serve and to ensure that the will of your people is also followed and committed by their leaders. You are the conscience of society, and we need you at the very forefront to ensure that we who have also been given the mandate by the people to execute on their behalf an agenda to improve livelihoods, we are also kept on our toes.
Quite timely there, President Uhuru Kenyatta addressing religious leaders, and tonight we have a discussion on the state of the nation with some of the top religious leaders in the country. Joining me live tonight is Archbishop Jackson Ole Sapit, who is the head of the Anglican Church of Kenya, live from his home here in Nairobi. Bishop Alfred Korir of the Kericho Catholic Diocese is joining us live from Kericho tonight. Bishop Margaret Wanjiru of the Jesus is Alive Ministries joining us live in studio. The glory is here tonight. Sheikh Ibrahim Lethome, who is a legal advisor and also a Muslim scholar as well, legal advisor to the Supreme Council of Kenyan Muslims, that's SUPKEM, as well as Bishop David Oginde, who is the presiding bishop at Christ is the Answer Ministries, as well, joining us tonight. Quite a wonderful speech you made at the launch of the BBI report the other day. that is what we are looking for, consensus in this. And let's start, gentlemen and lady of the cloth, with a discussion that's really top of mind right now, and this is the COVID-19 pandemic. And I'll start with you, Bishop Margaret Wanjiru, because this is, you've gone through this, and of course you went through treatment and you got healed. The numbers are rising right now. What would you tell Kenyans as we look forward to what the government will be telling us?
First of all, I would like to say that COVID is not a myth. It's a reality. You know, there are people who still think that COVID is a myth. It is a reality. Having said that, I would also want to say that the common mwananchi is working so hard to create a balancing act. A balancing act between risking and getting COVID as they go out there and work, as they socialize, as they go back to the markets, go back to their trade, go to do whatever they are supposed to do, and be able to put food on the table.
Yes.
But also risking starving to death. There is a great disconnect right now between the government and the common mwananchi. The people down there are starving.
Yes.
The kind of poverty that people are going through, it's unbelievable.
Okay.
So unless we are able to mitigate that poverty, we are not able to tell people, stay at home.
Yes.
Don't do this, don't do that. Believe you me, they'll still do it. Why? Because they have to risk. Either go out there and believe God you'll come back safe, or risk your family starving.
Okay.
Yep.
Among the responses here has been some tax relief measures for businesses and ordinary Kenyans as well. And is this enough? And I'm coming to you, Archbishop Jackson Ole Sapit, if you can hear me. Is this enough? And what are the followers telling you in terms of the economic burden that they have to deal with at this time?
Thank you very much. The economic burden is quite enormous for everybody. Businesses and livelihoods has been lost because of COVID. And the task reliefs, as you say and mention, may not be enough. So what we can say at this point in time is that people have to work, but we must take personal responsibility by adhering to the guidelines and the protocols, putting on masks, sanitizing, washing our hands, so that we try as much as possible to prevent ourselves and prevent those people who are around us at any one given time. so that at least the personal responsibility, in my view, must be taken so seriously to everybody else. And what the congregations are telling us and what everybody is telling us, the times are hard. It is a tremendous moment for all of us as a nation and as a people. And therefore, all what we can do is pray that the pandemic is wiped out, and ours is to cling on hope and continue to give people hope that there is a God in heaven when all else is not giving a solution, who can be able to provide a solution. But we must take personal responsibility very, very seriously.
Thank you so much, Archbishop Jackson Ole Sapit. Sheikh, places of worship were among some of the public spaces that were closed or, at the beginning of this, and we are seeing this sort of reemergence of COVID-19 infections. Would you encourage people to still keep coming to places of worship, go to perhaps all those social places that they go to, and you know, in the face of what we are seeing right now, what kind of steps would you like seen taken, I should say?
You see, I think to begin with, we know that God is in control always, COVID-19 or no COVID-19,
yes.
But we have to tie our camel, then trust in God.
Yes.
So what I mean is that we need to take precaution. We have to take precaution. If need be, we have to continue observing all those instructions from the Ministry of Health, because these are the experts in that area. Social distancing within the places of worship. If we have to wear masks, to continue wearing face masks, we have to do that. Sanitization, we have to do that, because God helps those people who help themselves. The problem we are seeing now is that we are letting down our guard. Of course, I want to agree with what Mheshimiwa Bishop Wanjiru said here. We have to, people are balancing between risking dying of hunger and also dying of COVID-19.
Yes.
And what does that say? The government needs to take more responsibility, because the buck stops with the government. You go for leadership, then take up the responsibility, not just the trappings that go with leadership.
Yes.
Take responsibility not only of the people up there, but also the people down there. Because I believe,
Yes.
and we keep on telling the leaders, you are answerable before God for these people that God chose you to lead them. So I think our leaders have failed us. Again, they should lead by example. We are sending wrong signals or mixed signals when our people are told to observe social distancing, and they see crowds of being addressed by politicians, and nobody is observing all that.
Yes.
What are we telling the people? That COVID is no longer here, or COVID only chooses the poor people, but the politicians
Yes.
are immune from COVID-19?
Yes.
Yeah,
That is a concern. That is a major concern. And Bishop Alfred Rotich in Kericho, we are seeing numbers rising in the counties, in the countryside, so to speak. What is it like in Kericho, and what would you tell Kenyans at this moment in time?
Immense experience by all those who have
Apologies for that, as we try to fix that audio issue that we are having with Bishop Alfred Rotich. Let's go to Bishop Oginde in studio with us tonight. There has been this, element of mental health coming about as a result of this. People becoming more anxious, people becoming depressed, and all these other things. How is it like? And I'm sure, as a man of the cloth, you get to speak to a lot of people.
Yeah, it's true that one of the things that this COVID brought upon us is the very first time as we were locked into our houses. Generally, human beings are social beings. So we get a part of our well-being through interaction with other people. And so when you're put into a locked space, you lose that sense of your well-being. And this is where issues like depression and so on come upon us, because like my colleagues have mentioned, you are locked in there, you're not able to go out, socialize with other people, you don't have resources to get food and do all that you normally would do. Many people have lost their jobs. Some people's businesses have collapsed. All these things are very depressive, and they can get you to that place where you are not able to contain the pressure that comes upon you. And so this has been quite prevalent. It's also right to say that there are families that are happy living separately. The husband comes in the darkness of the night, goes to bed, sleep. The wife also is there, children. So they are living in one house, but they are really not one.
Yes.
So what COVID did was to force these people into one space. And so you are here day out, day in, and you do not know how to interact with one another. Yes. And that has ended up with domestic violence, people fighting one another, quarreling over small issues. And so all these things add up to the well-being of an individual. And so we have seen that kind of rise, therefore, in mental health for children, for parents, for husbands, for wives, and all kinds of people.
Okay.
It's a reality.
Bishop Alfred Rotich, what must the government do now? President Uhuru Kenyatta says they will be reviewing these measures if we continue like this. What must the government do at this point in time, do you think?
I think it needs to show its face. We need to see how it's working.
Apologies for that. We seem to be having a connectivity issue there. Bishop Margaret Wanjiru, let me throw this question to you. What must we do as a people, as a government, first of all, in terms of response?
First of all, in terms of response, we need to do the civic education. You know why people still think that COVID is a myth and they don't believe? It's because nobody has really gone down there and given them facts. We just give figures of who got sick and who died. That's it. However, if you look at political matters, like now the referendum, you will find that TOTs are sent down there to go and do civic education. In this bill that we are discussing, the BBI, you will find that TOTs are being prepared to go down there and give civic education. In matters of health, why can't government go and speak to our people? Secondly, COVID is about, first of all, understanding. We started with coronavirus, then it changed to COVID-19.
Yes.
When you get sick and go to hospital, you even find it has another name. So names keep on changing. That needs to be explained to the common mwananchi. Thirdly, COVID is about immune system. If your immune system is down, COVID will attack and COVID will kill. So the truth is, our government must take responsibility, like what Sheikh has said. Our government must, first of all, provide the masks. One mask is going for approximately 50 bob. I don't think our government understands the people. Most of the people cannot afford 50 shillings every day for a clean mask.
Yes.
I can afford, all of us here can afford, but the people outside there cannot afford 50 shillings every day for the mask. They are dying to get their own unga on the table. Then, to finish on this, if it is about the immune system, then why doesn't government, if you can't give people free food, at least give them free mask, but also give them multivitamins? Multivitamins will build the immune system. Build up people's immune system, and people will stop dying from COVID.
All right.
That's it.
Let's take a quick break on NTV Weekend Edition. The hashtag tonight, The Religious Voice. Talk to us about what you think about some of the issues that we are discussing. When we come back, the responsibility of the citizen, that's you and I, and of course the other issues as regards the state of the nation. Stay with us.